Hey everybody, it's David. I'm your host of Highway to Health podcast series. We appreciate you being here. If you know anything about the podcast, you know we're focused on celebrating those that are innovating, disrupting the healthcare industry, and doing whatever they can to improve the patient access, the patient experience, and ultimately the patient outcomes for our patient population. And that's why I'm really excited. We're going to talk about one of the most trending topics in healthcare today. It's value-based care. It's something that we've talked about for a long time, but if you've paid attention over the last year, we've made more progress lately than we have for a long time. So today we have two great guests, the CEO of Olio, Ben Forrest, and the Chief Growth Officer at Olio. Her name's Rhonda Quintana. You're going to learn a lot from them today. I'm honored to have them on the show. Rhonda, Ben, welcome to Highway to Health.
Thanks for having us.
Thank you for being here. Hope you enjoyed Dallas. I know you're a native, but welcome here.
Absolutely. I'm not, but beautiful city, big state of Texas.
Yeah, beautiful day today too. So value-based care is something that everybody's trying to learn more about. We've seen tremendous progress lately, so we're going to get into all of those things. Also interested to know why we've been so bad at it for so long. So we'll get there. I like to start out the podcast this way. I appreciate you guys opening up a little bit. Tell us how you've implemented a healthy habit, mentally, physically, to make sure that you're at, your best level of health for the company that you work for. You're performing highly for them in that community, but also you're there and available for your family. If you don't mind sharing, share with us a habit you've implemented in your daily life. Rhonda, you want to start us?
Yes.
Yeah, let's do it.
Yes. I probably have two favorites. One is music is therapy. So I love listening to music, all different kinds of music, and that brings me joy. So I do that to kind of, bring me back to center. And I'm a yogi. I love doing yoga. So that is my outlet for keeping my mind and body kind of at center.
Are you a country music fan?
Very much so, yeah. Grew up on classic country.
Okay.
So, yeah.
Like the George Strait area or the Merle Haggard?
Yes, sir.
Okay. We'll have to talk after this.
Yes.
Big country music fan. What about you, Ben?
Rhonda, you're going to make fun of me. I'm almost scared to tell you all this because
I think I know what it is.
It's taboo, it's in the, ether right now. Folks are doing this. I started doing it about 4 months ago. I start every morning with 45-degree cold water for 3 minutes. And I've become slightly obsessed with it. And I don't have any idea if there's any health benefits. There may be none, and we may find out that it's the worst idea ever. But I do that at 5:45 in the morning, and I've got about 20 minutes to, kind of go all the way shocked to all the way comfortable.
Yeah.
And it's been very good for me.
So do you have a place, do you have a tub outside, or tell me?
I live in Indianapolis, so we could do it sometimes of the year outside to do its own work, but in my basement I have a tub that it gets 45 degrees and I get in it every morning.
Okay, I'm really interested in this because I recently did a podcast with a guy named Matt Brost. He's over at Lockton, and that's something that he does. And we just happened to be on location where they had one. And I used to coach small college basketball. And the only way we could get our guys to do it, our players to do it, was to do it with them. Yeah. But I hadn't done one in like 12 years. And I did one with him. And everything in my body said, get out of here.
Oh, yeah.
It was the hardest 3 minutes
I've
experienced.
It is, that's why I like it. Nothing, and it's hard every single time. Like, never once am I like, oh, I got this. Every time I have to mentally pump myself up. But I know that's probably it's the hardest thing I'm going to do that day. Maybe not be the toughest I have to think or use my brain, but just like straight discipline.
Yeah.
Get in, get out. And, then I just kind of go about the rest of my day and feel good.
What's the term when you do the hardest thing of the day first? It's like eat the frog.
Yeah.
Have you heard that term?
Yeah, that's right.
There's something good to that.
There is.
You've already accomplished something for the day, and you've got a win under your belt.
Yep. But like I said, somebody may a year from now say this is the craziest idea ever, and then I'll, quit doing it.
Well, it felt like I had a 10 cup of coffee morning after I did the cold plunge with Matt. because everything in my body was tingling for the next 45 minutes. So
For sure.
That's cool. I appreciate y'all sharing that.
Yeah, thank you. And I will get made fun of this, and that's okay.
No, I don't think so. You know, in Texas, if you put something out on the back patio or something, it's not going to stay very cold for very long. So I've thought of ways on how I could do it, because it is a trend right now. You see everybody at least trying it. I don't know how consistent they are. For you to do it every morning, that's pretty cool.
Yeah, it's we'll see.
Well, keep it up and let us know.
Oh, for sure.
How the benefits go. All right, so value-based care. You know, the podcast, Highway to Health, we talk about, we're in this golden age of innovation. The technology, the innovation, the automation that we've seen in the last 10 years has been incredible. And it's provided a lot of benefits for our providers and our patients. It's going to take a village, though, right? Instead of doing all of this in silos, we have to come together and collaborate. You guys at Olio use a term that I really appreciate, and what your vision and mission is aligns really well with this idea of it taking a village. And you talk about co-managing the patient through this value-based care model, which I would like to hear more about from you. Share a little bit about the vision and the mission of Olio and how that applies to co-managing these patients, you know, for the provider and for the patient outcomes.
Sure. You know, we at our company All Hands every month, we start with what's our purpose, what's our niche, and that correlates back to our vision where we're trying to take our company. But the purpose has been the same since we kicked ourselves under the table and said there's a problem here and we think we can fix it. And that is patients, stakeholders should work together. It shouldn't just be their primary care physician or their specialist. As complex patients become, as boomers age, as you know, value-based care grows, are really just the right thing to do. Co-management of patients means come together, work together. And so our vision has always been the same. You know, we've built software, but even just as a energy around our company is to be a trusted resource for value-based care companies that are really involved in being good at that, helping them understand how they're doing co-managing these patients and using software and technology to establish that process and kind of to just elaborate on the co-management part, because we get asked that a lot.
Yeah.
What's that mean? And if you're taking risk on a patient and all of your mind a lot of times and your strategy goes into how can we do really good to serve this patient population, inevitably there's other stakeholders that have no reason to care other than they want to provide good care for the patient. They're not a part of your organization otherwise. And we think those are the stakeholders, the clinicians, the social services teams, the specialists that should be co-managing together with a value-based care company.
Because it truly takes everybody. And a lot of times that perceived risk is because that provider knows that they don't control what happens outside of their walls, right, when they're rendering care themselves. But if they were able to co-manage and had some transparency into what was happening elsewhere through other specialists and other providers, maybe it would de-risk the situation for everybody, including the patient.
Yeah, absolutely. And Ron, to add color here, but we like to get leaders to think about things even a little differently. You know, it's one thing to have insight through data and otherwise, but access to teams that are providing care on your attributed life, and then even like extending that olive branch for them to have a process in a very simple way to ask for help, to reach out when there is maybe a transition moment or just adversity, be it social, clinical, or otherwise. And when that scales, right, a tremendous amount of value is provided for a greater population of patients.
This is really hard work. This is really hard work for value-based care organizations. And there's a lot of complexity around working with a lot of these external community stakeholders. And oftentimes, I think value-based care organizations have looked at that problem and said, man, I have no idea where to start. I have no idea how I'm going to take a look at this entire ecosystem of folks that need to help support this care journey,
right,
and figuring out ways to do that. And so I would just say that, you know, in terms of kind of surfacing the problem, I think you did a really good job in the beginning of describing kind of this dichotomy of, we're at an age where we have technology and opportunities to infuse ways that can empower the care teams to do this work, but there is a human element and a care management element of this that we're going to have to bring people together to really figure out ways to do this on behalf of the patient.
And that care journey isn't always linear.
It's very rarely linear.
Very rarely.
And Rhonda said it perfectly. Our vision is to aid in this and be a resource, a vendor, a tool, a team that value-based care companies want to work with. But that vision should be held regardless of our company be involved or not. You have to get this community of providers, whether that's teams inside skilled nursing facilities, home health providers, non-medical home care, dialysis centers, you name it.
Right.
A lot of groups have done such a good job of organizing their care management teams and their primary care engines and all the things that go along with that. And it's that final mile of pulling together the community that's sometimes the most difficult. But it also is ripe with opportunity.
Sure. Which speaks to the potential that we have to improve the outcomes of the community, of the patient community.
Right.
Because the opportunity is there, but we're working in so many disparate ways and in these silos that there has to be a platform that enables collaboration and co-management.
Right.
You talked about kicking yourself under the table, and that was kind of the vision that started, your journey down this path. There's probably some stories, maybe a story of a provider or a care journey and experience that added fuel to the fire for this vision and this mission. Anything come to mind?
Yeah, well, I think even so if you go back 5-6 years ago, late years Obama administration, mandatory hip and knee bundles were deployed in orthopedics. And it was, I think, 67 cities across the U.S. And the data from that time period is pretty strong. That effectively, when you elevate the specialist in that sense, or a primary care physician, whomever, to own the episode of care and all those things, it's a pretty good way to have those entities lead in the patient's journey, right? And that element of leadership is very important, in my opinion. But the kick yourself under the table thing it's mind-boggling to me when the revenue scenario changes, forced or otherwise, adopted, however that comes about, Medicare Advantage, the reason why becomes elevated, and that's important. And as we started to just hang around the hoop and be a part of these discussions, it's just unbelievable. Data is talked about so much. Pulling data, integrating data, all the things. Well, sometimes Mary Smith in the home providing care just wants to say that my patient might fall tomorrow, and just little things like that we really wanted to solve for and lay that process down. And we're fortunate, just like any early stage company, that have some success and failures that you learned off of, and
sure,
here we are.
That's that kind of speaks to why, as an industry, we've really struggled probably over the last 10 years, and now we're starting to see progress, right? Technology plays a big part of that. Remote patient monitoring solves for some of those challenges that you just described. But I'd like to get your opinion on the driving factors behind this push that we've seen and the increased adoption that we've seen from the different health systems and specialties with value-based care. What are some of those driving factors, and why are we seeing some of the progress and success that we've seen over the last few years, especially after struggling for so long?
Yeah, Ronnie, you probably got thoughts there?
Yeah, maybe just I'm sure that your viewers are very sophisticated in this space in some regard, but obviously you probably heard about 19% of our GDP in America is, we're spending that on healthcare. That can't continue. We've had policy changes that have incentivized, organizations and providers to think about how to do this and really embrace kind of these value-based care initiatives, if you will. And frankly, CMS is, telling the world by 2030, everyone that's participating in some sort of, Medicare or Medicaid type of program is going to have to be in some sort of value-based arrangement, because we really want people to focus on quality, not quantity in terms of how often we see the patient. And so I think we're just seeing some trends around trying to be a little bit more proactive in terms of really treating a lot of these chronic conditions, and frankly the acuity of some of these patients and the different levels of care and the sites of care that are changing are kind of the impetus of why some of this stuff is becoming more accepted, and you're seeing some of the advancements around people being more open to this. I think if you look across the country, there are parts of the country that have obviously been a lot more bullish about taking that on, and there are some parts of the country that really are digging their heels in, and so it's been interesting to kind of see how different parts of the country are behaving in that regard.
It is interesting, and there's reasons for that, even for the geographical differences. But we touched on how it's going to take a village. Legislation's a part of that village.
Sure.
And you mentioned that 2030 date. It's a little bit of the carrot and the stick motivation for the entire community to start adopting and problem solving.
Yeah, absolutely. I mean, we can't run from it as a part of the U.S. economy. It is what it is. It costs us a lot of money, a lot more money to treat patients than other competitive countries. It's just a fact. I think that, again, even going back to our early days of kicking ourselves underneath the table, that the ability for the physician to lead in value-based care is so important. I don't have all the answers. I'm trying to learn myself on how real that is or isn't. Are health system CEOs and CFOs going to think about ways to incentivize, to realign their own physicians, whether it be specialists, primary care, or otherwise? They may or may not, don't know. I think that's a unique opportunity. I think there's a lot of success stories out there right now from independent medical groups that physician burnout is decreasing, physician compensation is going up because of their kind of whole health approach and value-based care approach versus running the clinic maybe a traditional way. And I don't want to make any declarations, but I think that that's possible that thing flips over potentially. It could do a lot of good for a lot of people. I
was at a HBMA event earlier, and just so that I give Steve Hunt credit for this, he said, when talking about value-based care, that in a way, and if done correctly, value-based care could empower the providers to render the kind of care they got into the industry to render.
Amen.
Mm-hmm. And I thought that was really well said and inspirational, which is probably driving some success at certain providers already. You've probably seen the good and the bad in your roles.
100%.
And I'd like to hear maybe some of those success stories that come to mind. Maybe not, you don't have to name them if you don't feel comfortable. If you do, great. But what are some of the common trends or common characteristics of the providers that have found success through this model, through this arrangement?
Yeah, I think first and foremost, common sense. It's mind-boggling to me that sometimes it's hard, and we have people kind of push back on our organization at Olio, is if you establish a process, pick the level of care. It could be hospital working within an entire state's skilled nursing facility ecosystem or home health or otherwise.
Right.
One common data point that we lean into that is very real, teams that work together more often per patient per week, shockingly have better outcomes. It is the most simple thing ever. You make it easy for them to work together, good outcomes occur, right? And so I think that...
Can I stop you?
Yeah.
If it's that simple, why have we been so bad at it for so long?
It's hard. My team doesn't necessarily love it when I do this, but I do keep doing it. So at some point, maybe I'll get embarrassed by the cold plunge thing and then now this. But, somebody decided that people out running around Dallas could drive people in cars instead of us using taxis. With software and technology, name the value-based care organization. There's 2,000 clinicians in these levels of care working there, available, caring, vulnerable, and also smart, that could very well help guide that patient's journey. It's just very hard for them to connect A plus B in a given moment.
Right.
And so if you roll a red carpet out across the state and teach everybody that process of working together, that value-based care organization leads, that kind of leads me to my example without naming names, then you kind of go back in time a little bit, and that we had a retired physician now that when he first came out of residency as a primary care physician in the 80s, he was running their patient panel was cared for entirely different. And he would go to homes, he would go to skilled nursing facilities, obviously round in the hospital, right? And through software, and frankly, our product or otherwise, you can build those relationships and you can provide more access to others that are aligned to the patient outcome, right? And so that's the thing that's been kind of eye-opening to us, is, a lot of our clients are working with hundreds of skilled and home health providers, non-medical home care, behavioral health, hospitals, in one centralized working environment. And we track how often they work together per patient per week.
Really?
And when that volume's up, good things happen.
They have a hard time exchanging information as well, right? If you think about all these different entities and all these different levels of care, they all track that clinical information in their own way. And for them to be able to kind of have a place to be able to share the relevant information in that moment for that patient to deal with that episode is really powerful. And so one of the things that we continue to see is when that information, the right information, can be shared, outcomes get better, right? Quality scores go up because everybody can get information that they need in order to make the best clinical decisions and care strategies around a patient.
And sometimes it's very simple information too.
Yes.
Like, this patient's probably not going to do well unless we get her name the DME device. Right. And this is why I think that, because I'm a therapist and I've just worked with her for the last 2 days, right? That may not be in the exchange of information, but hey, if I could just share a little bit of my knowledge that I've gained over the last 2 days working with this patient and have a very easy way to do that, that I know is going to be reciprocated. And it's also very unique to watch these relationships grow, people that never see each other's faces, but they work together so often because it's easy. And then their knowledge comes out just as much, and it's important to have documentation and discharge summaries and EMR access and all those things. But the human part, and I think that's the thing that's to your point, it's why a lot of them went to school in the first place.
Yeah. And they probably learn a ton from each other when connected in this way.
Right. And
can become better in their own role through the guidance of somebody else in a different role.
It is absolutely insane. There are some of our users inside of Olio that they have been described as celebrities across a state because they have access to a person that can help them co-manage patients that are coming from these entities. And so it is remarkable how oftentimes they're doing this through technology, but they get to know each other and they get to know how to work together in a very unique way.
I'm really glad you said that, because the expectations that we have in our personal lives, we feel like we know people that we've never met through technology and some platform, call it whatever you want. Maybe it's social media, maybe it's something else that teaches you something new. They're an expert in some way.
Yeah.
And you learned the cold plunge from somebody. Right? You saw it somewhere. It wasn't a physician or a doctor that prescribed it to you. But anecdotally, you saw somebody have success in this way and thought, I'm going to try it myself. Those expectations and experiences that we have outside of healthcare are relevant when rendering care and tracking this care journey for our patients. We can take those expectations and implement them in some way in healthcare.
Right.
And the way I hear you describe this collaboration and co-management and this expert or influencer or celebrity type experience that these caregivers give, in addition to the patient experience and outcomes, how cool is it for that caregiver, that provider, to be seen as an expert, a celebrity, an influencer that can share that knowledge, help somebody else find some success. There's a ton of personal value to that. And we're facing all kinds of shortages and burnout. That might be a small way to improve the experience of our providers too.
Without a doubt. I mean, the last thing anybody that signed up to take care of people needs to spend any time doing is waiting for information or people to help deliver that care. Now, there's a lot of noise, right? And I think value-based care companies are getting good, and some of that's guided by the economics, if we're being transparent and real about it, about making it very simple and easy for patients that are entering complex end-of-life environments where the cost of care might be very, very high, to build infrastructure, assets around that patient, smart folks that are trained, educated, and, you know, instead of waiting in line at the concession stand, let's put them in the game, right? And that's kind of how we think about things, and frankly, we ask our clients to hold us accountable to that. In theory, a value-based care organization should be able to build a rock star team and work with 1,000 or plus patient stakeholders across their catchment area.
Back to your, and I'll say the name, back to your Uber example.
Yeah.
Democratizing and empowering the community to take care of the community.
It's exactly right. I think that through software and elevating those stakeholders that are not a part of the organization that's taking risk, that empowers leadership from that value-based care company to elevate the patient underneath that entity's care and help and be a vulnerable resource to support, not just, you know, do it our way type of thing.
And they often do have resources that those other care teams need access to that they don't have maybe in their current environment. And we've seen lots of examples where they reach out to the entity, you know, through Olio and can get access to social services. And hey, my patient is refusing home health services. You know, we see sometimes up to 30% of those patients that are refusing home health services, and they want to be able to impact the opportunity for the provider that has the relationship with that patient to say, Mrs. Smith, let me tell you all the reasons why this is a good idea, right? You may not catch all of those or capture all of those folks, but you can really impact the outcomes of those patients if the people that they have a relationship with and trust, you know, through that process can get involved and to influence.
One of the main things that prevents the healthcare industry from true progress is the perceived risk. Every dollar matters, probably more in healthcare than any other industry because there aren't many of them and they don't go around very well. Yeah, it's not spread evenly sometimes, the revenue that is. The biggest perceived risk is tied to attribution, and you've talked about, you know, this idea of bringing in the community to take care of the patient. The attribution challenge has got to be kind of the big elephant or the big gorilla in the room that's scaring some systems and providers from truly adopting this model. Talk a little bit about how we can help solve that attribution challenge and maybe where we could go from here to de-risk the situation for our providers. Because we've talked about a lot of stakeholders in this care journey now. So who owns the patient, who's the primary, and who gets the money for it? How have you seen that problem solved, or where are we on the path to solving that challenge?
I think that what we've seen recently is some pretty interesting trends around attribution. Attribution's been a challenge for a lot of organizations for a long time for a number of reasons. And just to kind of bring a practical example forward, right, if you have a patient that is attributed to a particular physician in a particular medical group, for example, when that patient ends up in different levels of care in the hospital, in some sort of post-acute setting, let's say a skilled nursing facility or home health, oftentimes as they go through those different levels of care, these folks after the hospital have no idea that this patient is actually attributed to an organization that is actually responsible for the clinical and the financial outcomes for them. So the big challenge for a lot of these organizations and a lot of the, I think, trepidation that you probably are speaking about is really about how am I going to take on the downside risk of owning this patient in my attribution and be able to impact the clinical and the financial outcomes. And so until we figure out how to integrate and bring those care teams together, because you're never going to be able to deliver 100% of the care of that patient inside the four walls of your facility, right? And so we've got to figure out ways to be able to have co-management relationships, because patients still have choice. They can still go out of, any kind of network. They can influence and they can, do the best that they can. But at the end of the day, we've seen attribution trends where, for example, primary care doesn't own necessarily the live anymore. It could transition to a nephrology group, right? If this patient has CKD, or they have a kidney condition that really is, they're seeing and having dialysis 5 days a week, right? That attribution now is transitioning over to folks that are willing to take on the responsibility of that patient in those different care settings. And so we're seeing a lot of interesting ways that specialists and or other groups are trying to get better at influencing the outcomes in certain cases. But that's the big elephant in the room in terms of why attribution continues to be a challenge for a lot of these groups. And I think that if we're talking about how do we solve for that, that's one of the things that Olio is really dedicated to doing, right, is elevating those patients that end up in different levels of care, so that everyone has visibility to say, okay, who do I need to reach out to get help? Who owns the financial and the clinical responsibility for this patient?
Anything to add?
Yeah, I think, well, one, and I might get in trouble for saying this, but there's plenty of money in healthcare. It just might be in the health plan, right? There are folks with very, very tight budgets. I think that
there's a reason certain stock prices go up and others go down.
Yeah. Non-for-profit, for-profit, totally different scenarios sometimes. We've seen it inside our own business. I think one thing that's exciting, and I will name drop, Banner Health is a large organization, multi-state health system with its own health plan that is not small. I've just been truly impressed. We have a lot of clients that are big value-based care client names, but a large, geographically significant to the Southwest health system health plan where the ethos around providing the best care regardless of authorizations, delegation, attribution from an ACO perspective, I think it's consistent, right? And that's unique in my opinion. I could be wrong, but the uniqueness of being a community large health plan, I presume has good books, but also doing the right things, right? It is mind-boggling to me to watch teams in the greater Phoenix area work daily with teams in Yuma, Arizona, 3.5 hours away, where Banner does not have a standalone hospital.
Yep.
That's amazing, right? And so I bring that up, and hopefully I don't get in trouble for dropping their name, but I'm just impressed.
Yeah. Well, and I think an organization of that size, with all the complexities that they're facing, if they can do it, right? I know a solution for one is a solution for one in healthcare. Everybody has their own challenges.
Amen to that.
But it's a good example of what's possible. And the consistency has to be a big part of it.
It does. And I'm excited. I think that a lot was learned during the pandemic around fee-for-service versus value-based care and health plans and MA specifically. I think that I presume in San Francisco, when everybody gets together for JP Morgan or otherwise, and all the big brains around capital and healthcare start to think that there is a lot of forward movement in serving populations of patients that are aging beyond 65 and what that can do. I tell our team all the time, like, our job, Olio's a shovel. Our job is to help these groups dig a hole, but they got to dig the hole, And so we're very excited about where things are going. It's a little slower just because of the current, the economic conditions and the pandemic sunsetting and all those things. But I think the future's bright.
Yeah, I do too. And yeah, you call yourself a shovel. Every hero and every story needs a tool.
That's right.
Otherwise, they're powerless. And the purpose of Highway to Health is to celebrate the tools that are empowering the heroes to do awesome things, because we need it in healthcare. So I appreciate what you guys are doing. And the task is not small. Before I let you go, we've talked about a lot, right? We've talked about cold plunges. We've talked about yoga, country music even. But if our listeners walked away understanding one thing, what's the one thing that you want them to take away from this podcast?
I probably have two things.
Okay. Breaking the rules.
Breaking the rules, I'm sorry. One is, and I'm going to use the words of a recent conversation that I had with one of our clients, which was, you don't even know what is possible when you can bring care teams together. And we've seen some remarkable stories, remarkable patient stories that come out of our clients' experiences, and that's a very inspiring part of the work, right? But here's what I would say. Most of the healthcare professionals that I talk to on a day-to-day basis, they oftentimes don't want to talk about their healthcare professional experience in this regard. They want to tell me about a personal experience that they've had with being a caregiver or themselves with going through a care continuum when care teams aren't connected. And it's really painful to hear these stories. And so we're all aging. We're all going to have those moments. Our families are aging, and we all need to really think about, on a personal level, how important this work is, so that we can really achieve the kind of outcomes that we all want as patients ourselves.
Exactly. We're all patients. Well said.
I think I take up two things, but same idea, but two thoughts. One, just continuing to be, I continue to be excited about value-based care. Hopefully that folks listen to this can get excited with me. The opportunity for leadership, not only the U.S. government, CMS, and health plans, and all those things help foster the ability for those leaders to come to the surface, which is amazing. So I'm excited for more leadership. And then the final piece of that is the amount of awesomeness that comes out of skilled nursing facility clinicians, home health clinicians, behavioral health sites. These people have angel wings on their back, like for real. They're there. And there's folks that have been in that world for 30, 40 years and haven't left during some pretty gnarly times in the last 5 years for sure, right?
Right.
That resource being such a good infrastructure, and I don't think they get the credit that they're due. I hope that if somebody listened to this, and we didn't talk about it extensively, that as we think about leaders in the community, and then obviously that awesome infrastructure that might be there, because they are just as sharp as any branded name brand healthcare organization in the United States. They're good.
There's experts everywhere.
That's right.
And sometimes we just have to unlock the voice, unlock the experience, improve the collaboration or the co-management, and that's when the true improvement happens. And you just need a platform sometimes.
Amen.
And I appreciate y'all being here.
Yeah, thank you for having us.
Yeah, sharing these stories, educating the audience, the community. We're going to get there.
Agreed.
And it's companies like Olio that are going to help us. So good luck to y'all.
Thank you so much.
Thank you.
Appreciate it. Thanks for having us.
Thank you.